Let's talk about the difference between governments working well together and Washington. The fiscal cliff for a moment. Kathy, you mentioned the fiscal cliff. Now, we have just sort of backed away from the fiscal cliff a bit, at least for a while. Do you feel that, I guess, the trauma is over for at least for a while?
No, I don't. My bigger concern was the debt ceiling and remains the debt ceiling. Without solving that problem in some way, I think it's the uncertainty that comes from what happens if we hit that ceiling, I think is much greater than the uncertainty of, well, if we, how are tax rates going to change? I don't want to underestimate that impact, but certainly, okay, payroll taxes could go up, 2%, we had some idea of what was coming. I think no one really knows what would happen if we hit the debt ceiling. And so for me, that's a much greater concern than the other issues.
Jerry, what do you think the effect on the financial markets could be if the debt ceiling is hit or if these cuts go into effect?
Well, when you think about the debt ceiling, to me, we should be moving the entire conversation away from the debt ceiling. We should be picking fights around sequestration or the debt ceiling, to me, creates a real serious impact because it affects our ratings. It affects the cost of borrowing for this country. The third largest budget item for this country is interest cost. And at a $16 trillion debt, a 1-point increase in interest cost is a substantive $160 billion added cost to the government. And so, not to mention just the fact that when you think of the percentage of our debt that's held by China and Japan, and out of the control, and in many other countries, you don't want to have that much exposure to foreign countries who may change their own policies on where they want to invest. And so, to me, we really need to move the conversation away from the debt ceiling. I think the debt ceiling, we need to meet our obligations and focus on the real issues, which are, do we have a long-term trajectory for this country that is stable and predictable and gives a sense of fairness and balance to the populace. And I think that's what the country's looking for in terms of where the government goes here. But it's an issue.
Barry, how do you see the Washington threats?
I'm feeling very strange stuff in this. I used to be, you remember when you used to introduce me, and now we have Dr. Doom. and I've actually become quite optimistic. So let me tell you what I think is going to happen. One, we're not going to go over the fiscal cliff. We're not going to have a ceiling problem. And the reason is, very simply, the Republican Party is teetering, and if they push us over that cliff, it's the end of the Republican Party as we know it. And Boehner's not going to allow that, and we're going to get through that. Whether we have to coin a $1 trillion coin, I'd like one or two of those, I think we're going to get through it. The longer run problem, though, is we can, as people have been saying, kick the can down the road, or we can say, look, we have two major problems in terms of the federal debt. One is minor. It's Social Security. That can be solved very simply by raising the cap a little bit or raising that tax rate a little bit or raising the age that you can collect a little bit. Medicare, Medicaid, that's tough. And, attempts to solve that problem make a big difference. A couple years ago, we were asked at the Dukakis Center to actually study the healthcare sector. And we went in for something called the Bipartisan Commission in Washington. And we projected healthcare out to 2030. Now, we were at about 8 to 10% of GDP in the 1960s was healthcare. We're at 18% today. By 2030, if we continue the track we're on, we get to just under 30% of GDP, which is impossible, but we would get there. And what drives it? Well, I thought it was age. We're all getting older. We're using more healthcare. Minor. Part of it's driven just by population growth. Part of it is driven a little bit by inflation. The big reason why healthcare is rising is we're all using so much more of it. And what we have to do is to figure out ways to deliver that care more efficiently and more effectively. I just had a physical the other day, and I went to the physician's assistant. I didn't see my actual doctor. I see my doctor when I'm real sick. We've got to figure out ways of delivering health care because that is the big driver of the deficits. If we do that, the rest of the problem becomes much easier.
Okay, thank you.